A new report ranks states on patient access to medical marijuana. Thanks for staying with us. I'm Evan Forrester. And in that report, Pennsylvania does slightly better than the national average grade of a D. Fox 43's Harry Lee spoke with advocates who say there's still a long way to go.
In patient access to medical cannabis, Pennsylvania gets a C+. That's according to a new report released by advocacy group Americans for Safe Access. A major factor? Cost. Getting a card in Pennsylvania costs around $250, and patients have to renew every year. That's in addition to the cost of the medical cannabis itself.
This is something year in and year out we hear from cannabis patients. It's something that I hear definitely most often when patients talk about the burden of this program.
Pennsylvania's nearly 400,000 registered patients can be fired from their jobs or evicted from their homes for medical cannabis use. State Representative Chris Rabb, himself a cannabis patient, is working on legislation to change that.
The laws have not been modernized appropriately to address the considerations of law-abiding medical cannabis patients like myself.
Among legislators, bipartisan support is also growing for full legalization.
We are indeed debating the possibility of legalizing adult use cannabis.
But patient advocates warn that shouldn't lower standards for medical cannabis.
Adult use laws are separate from medical cannabis laws. The two programs can coexist in a state, but one is not a replacement for the other, and they do need to remain separate.
Patient advocates say it's hard to navigate medical cannabis laws across all 50 states, and only the federal government has the power to standardize them. Harry Lee, Fox 43 News.